Here we have a patient with normally hydrated skin, well trophic, who complains of the first signs of aging. That is, the appearance of a slight reticulum at the sides of her eyes, that the patient calls crow's feet, and a very light initial barcode. The patient also wants a small volumetric increase of her lips in very contained terms. We'll give, therefore, a bit of definition to these lips and try to improve the eye contour. We apply a cream while the consultation takes place. It's an ointment with the lidocaine base. That is left to act for about 10 minutes. To complete the anesthetic action of especially sensitive areas like the eye contour, we use this cold device kept previously in the freezer. For this patient, we have decided to use a polyvalent product, which is a particularly fluid hyaluronic acid that can be used without fear in all the areas of the face. This product, too, is provided fully equipped with two 27-gauge needles. For a particularly thin area of the skin, like the eye contour, my advice is to try to inject it with a 30-gauge needle. The extrusion is a bit more difficult, but it's much better tolerated by the patient. We continue injecting the hyaluronic acid, keeping the needle very, very superficial and tangential to the skin. The needle can be seen through the skin itself, as it is very thin in these areas. The injection is made in a retrograde way, depositing very small quantities of product inside the wrinkle itself. We make an immediate compression because this is an extremely vascularized area that bruises easily. We inject a little quantity of product, which we massage and distribute to avoid the appearance of the drawstring effect. I always start from the top, but this is an individual choice. Be very careful about the veins that, as we said, are especially numerous and superficial in this area. As you can see, the little ridge disappears at once. It can also be injected with a technique with microponfi. very small drops of material, injected one after the other. We changed the needle. And to correct this tiny barcode and this initial flattening of the upper lip, we proceed with the injection along the vermilion. The injection is retrograde, with the file lift technique to give back to the upper lip that shape of heart, which is particularly feminine and particularly appreciated by women. The file lift technique envisages, in fact, an injection also in the V-shaped central area of the lip. As you can see, the lip's heart shape becomes more marked. And finally, a very little quantity of product is injected in the central area, which should make the lip especially sensual. Now we apply the antibiotic ointment. The result is a very natural face with a more rested appearance. In this case, we have a young woman who wants to improve the look of her cheekbones, her eye contour, and, if possible, would like to revitalize her neck and décolletage. We'll proceed, therefore, first of all, with the pre-operative design to define the area of the cheekbone we will fill in. Starting from the top corner of the ear, we draw an ideal line all the way to the lips commissure. A second line unites the top corner of the ear with the nose wing. For this purpose, we will use this product, which is a cross-linked filler at high density and very long duration, included between 8 and 18 months. It's especially suitable for the areas that undergo stress, like the folds of the nose and the volumetric increase of the cheekbones. We will now disinfect the area we are about to work on. For this purpose, we will use a needle cannula. In this case, with a diameter of 27 gauge, especially flexible, but suitable to introduce a filler of such viscosity. The little hole on the skin will be made with a 27 gauge needle with a sharp point that will allow us to introduce the cannula easily. The introduction of the cannula is easy and practically painless because it is blunt. The filler is introduced with a fan-shaped technique. That is, a little quantity of material is let out when taking out the cannula. Do you feel pain, madam? Just a little tingle. The cannula is introduced again. And always with the fan-shaped technique is gotten unthreaded injecting the filler. The increase of the cheekbone area is especially indicated when you want to recreate the volumes of the face that tend to flatten out because of age, and to make a kind of mini lifting. Not very invasive for the patient, because the smoothing out of this area is able to lift the part of the cheek, and also improves the nose folds that, as we know, are caused by the sliding down of the whole cheek. The tunnels are adjacent. To avoid the formation of furrows between them. The lady does not wish to have a very pronounced cheekbone profile, so it will be enough to introduce a 1 mm file on each side. In the first hours after the implantation, the product is especially pliable, so we shape it with our hands till we get the volumetric arrangement we want. After 24 hours, the filler will take the definitive form we have given it. As you can see, the use of the cannula has allowed us to minimize the trauma for the patient. No bruise, no ecchymosis, no visible sign. The patient can go back to her working life, her public life. Now we have this case, a young patient who has strong signs of photoaging, probably of genetic origins. She is a smoker, so she complains of the presence of the barcode. We will use, therefore, a cross-linked filler of medium viscosity, suitable, as the name says, polyvalent, for all areas of the face. We show the patient that the product is sealed. We open it in her presence. Take out the sterile wrapping. The packaging is sterile. It has inside a pre-filled syringe, 2 27 needles. As an alternative, I prepare also the 30-gram needles for the particularly sensitive areas. We intervene on the lips outline to recreate the board of the vermilion that has flattened out. So, at the same time, we get a reduction of the barcode the patient complains of. We keep the edge of the lip pressed, so that the leakage of the product is homogeneous and perceptible by our fingers. The patient has been previously treated with an ointment with a lidocaine base, about 15 minutes earlier. Ideal complement for this treatment is a paving with a hyaluronic acid for restructuring. Like the product Genyal, which has the capacity of spreading. So, in the following months, we will invite the patient to undergo repeated revitalization treatments. Having to follow this type of barcode that has a lesion that looks almost like a scar very deep in the derma, it is indispensable to follow the sign linearly. Finally, we apply abundantly an antibiotic ointment that we will advise the patient to apply in the 3 following days, accompanying it, if possible, with cold compresses. In my experience, ice is not advisable. To improve the aspect of the patient when she comes out of our office, I always apply a covering foundation cream that minimizes the signs of the injections and makes the patient less ill at ease towards the public she might meet. Here we have a very active middle-aged patient who has exposed her face to the sunlight a lot and has evident signs of photoaging, spots, loss of volumes, loss of elasticity. The continual exposition to the sunlight ages the face prematurely. For the treatment of this patient, we will use a product called Volume that we use to re-establish the volumes to the 3rd lower part of the face. It is a molecule of cross-linked hyaluronic acid with exceptional duration for a filler that is eventually absorbed, although we know that the duration of the filler depends in great measure on the product's physical chemical characteristics, but also on the stress caused by the patient on the filler itself. It is evident that in a superactive patient, like this lady, who exposes her face to the winter sun of high mountains and to the summer sun of sailing activities, fillers have a decidedly lower duration. We pre-treat the skin with a disinfectant solution like Citrosil. In this case, the filler must be injected with a 27-gauge needle, as the viscosity is such as not to allow it to get out with smaller caliber needles. So it is a bit more painful for the patient. Let's deal first with the furrows of the nose. We give an injection with a fan-shaped technique in the deep derma, in the area near the nose. Let's massage the product. Does it hurt, madam? Not at all. In this case, it is necessary to use enough product to re-establish the missing volume. You add it a little bit at a time till you reach the desired correction. It is not advisable to go any further. We'll proceed to inject also this area for the so-called marionette folds. Injection always radial or fan-shaped with anti-retrograde technique. The localization is the middle derma. Let's check in an orthostatic state. The improvement over the contralateral part is obvious. This area requires a further touch-up, and this area too. Sometimes it is preferable, especially when you're treating the third lower part of the face, to inject the patient in an orthostatic state, that is, sitting on the couch. If it is possible, let's always use the same entrance hole to reduce to a minimum the patient's trauma. The important thing is to infiltrate the filler correctly at the sides of the nose, where the nose furrow starts. It is a bit painful. With especially sensitive patients, I use a truncal anesthesia of the infraorbital plexus. The area of the injection is still the deep derma. The product is palpable, like a little prosthesis that you position where there is a deficit to correct. We will inform the patient about the presence of this filler so that she is not afraid of it. Long-lasting fillers like this can, in the following days, cause a more intense reaction than more fluid ones. So, we advise the patient to be more accurate in applying an antibiotic ointment for 3 to 4 days after the implantation, morning and evening. Over this ointment, you can apply a covering foundation cream. Cold compresses might be useful, but not the ice, which tends to harden the filler too much and to paradoxically increase the inflammatory reaction. We can lift the external corner of the lips commissure that, at a certain age, tends to go down, giving a sad expression to the mouth. In general, all the patients appreciate the lifting of the external lips commissure. Let's add a bit of material in the lower third of the nose fold. Let's check the symmetry. With a bit of makeup, the patient can go back to her social life at once after the implantation. This lady wishes to improve the aspect of her lower lids, in which the nasolacrimal furrow is particularly pronounced. The ideal would be a blepharoplasty, but the use of the injection of hyaluronic acid through the needle cannula, being not very traumatic, is a valid alternative to the blepharoplasty that can, therefore, be postponed by some years. We can notice this purplish furrow that delimits the nasolacrimal corner, which is particularly evident for the herniation of the periorbital fat. Injecting hyaluronic acid in this area, we make this furrow much less evident, giving the eye a much younger look. The application of a lidocaine-based ointment makes the area to treat much less sensitive. For this purpose, we will use the polyvalent cross-linked filler that, as the name says, is a polyvalent filler that can be injected in the various areas of the face. The extreme flexibility of these cannulas allows us to get the result we want, using only one access hole. The blunt point makes them very little traumatic for the tissues, and so it reduces to a minimum the possibility of bruises, especially frequent in this area. The material is introduced in parallel tunnels, adjacent to each other as much as possible to avoid furrows and folds. As you can see, the bluish furrow has practically disappeared. And to obtain this result, it was enough to inject half a vial of the product. The cannula used is of the 27 gauge type, to cause as little trauma as possible to such a delicate area. And the extreme fluidity and manageability of this filler allows us to do that. The filler injected can be easily modelled in the first hours with a slight massage. This is the result at the end of the infiltration of hyaluronic acid in the nasolacrimal furrow. You can see that the bluish halo has disappeared. The area appears more relaxed, equally filled, and with the complete absence of signs of the introduction of the needle. The hands, we know, tend to show the signs of time because the subcutaneous tissue decreases and the hand takes on a so-called skeletal look. Injecting hyaluronic acid of the revitalizing type, we can give the hand a decidedly younger look and to fill in those furrows that, with the passing of the years, become especially evident. For this purpose, the most suitable product is Genyal, a filler based on hyaluronic acid with a particularly fluid formulation, suitable to spread, to fill in and revitalize all the areas in which it is injected, giving a special hydration and softness to the areas treated. The technique used is always the same, fan-shaped technique of retrograde infiltration. This mix of hyaluronic acid and glycerol has a very unique effect on biorevitalization, that is, the stimulation for the proliferation of the elastic fibers and of the collagen fibers that will be used to restructure deeply the connective tissue. You see how the cannula slides under the skin and allows the deposition of the filler even in areas far away from the little entrance hole, with minimum trauma and problems for the patient. The filler introduced is massaged and distributed equally, so that it can exercise its biostimulant action. The difference between before and after the treatment with the revitalization based on hyaluronic acid and glycerol is particularly evident.